Hello learners, today in this lesson we are going to talk about different types of diseases and how to identify with the symptoms and how to take care of them. In this lesson we are talking about the communicable diseases and lifestyle diseases, and when you have the disease, any kind of thing, you need to see the doctor. In this lesson we will start with the what is health, and very popular statement given by WHO in 1948 on health definition. Health is a state of complete physical, mental and social well-being and not merely the absence of disease or infirmity. It means the proper functioning of the body and mind. When you are healthy, how will you look like and how will you feel? Good health makes us more cheerful, energetic, full of life, more efficient at work and therefore more productive. What are the factors which affects the personal health? Because we are talking about the health, then only we can differentiate the health from the disease. So we are talking about the factors affecting personal health: balanced diet and food hygiene, good hygiene, personal, family and community. We will talk in a detail little later. Physical environment like housing, where we live, in which we live, water supply, access to health services, cultural practices, relaxation and sleep, avoidance of alcohol, smoking and drug abuse. So these are the factors which affects the health. Now let us learn what is disease. Disease is a state in which normal functioning of the body are disturbed and the individual physically and mentally feel weak, lethargic and develops many kinds of symptoms of the disease. I repeat, the disease. Disease is the state in which the normal functioning of the body are disturbed and the individual physically and mentally feels weak, lethargic and develops symptoms of the disease. When we have the disease, we always remember the doctor. Why? Because doctor can diagnose the disease and prescribe the treatment for that. But there are broadly two kinds of diseases. One is lifestyle diseases and another is communicable diseases. What is lifestyle diseases? These diseases are developed by environmental factors including lifestyle practices, wrong food habits over a long period of time. This is the main cause of lifestyle diseases. So these are chronic diseases and leads to poor immunity. There are conditions throughout life which needs the management and medication. So I repeat or explain in a different way when you have the lifestyle diseases like diabetes, heart disease, anything. This is the disease which are due to the lifestyle pattern which is not favorable to our health, but needs management and medication always to be free from the disease or manage the disease and still without the symptoms. What is lifestyle? Lifestyle is the pattern of living that follow on the regular basis. How we work, what and when we eat, how and when we sleep, how much physical activity we do and whether we smoke or consume alcohol or not. Now we are talking about what is communicable diseases. Communicable diseases are spread by the germs or microorganism which may include the bacteria, virus, etc. These diseases are also called infectious diseases or communicable diseases, and these are usually the short term and greatly influenced by the immunity of the person. As I said, it occurs due to the microorganism, and where these microorganisms are present? In food and water, air, contact and insects or rodents. So modes of communicable diseases are food and water, air, contact and insects. These are some of the communicable diseases. We are going to talk in detail some of them. If the mode of communicable disease or spread of microorganisms is air, then you can catch the flu, streptococcal throat infection, tuberculosis, pertussis and chicken pox. And if mosquito bites, then you can have malaria, dengue, Japanese bee encephalitis. In here you will find what is the causes. So, that means mode of spread you have learned, one is food and water. And what are the symptoms? For cholera, sudden onset of severe watery diarrhea. Feces looks like rice water, vomiting, cramps in the leg, and patient feels very thirsty. How to manage it? And here you are seeing one word, incubation period. For cholera it is 1 to 5 days. I will explain what is incubation period. Incubation period is that when there may or may not be the symptoms, but the disease can have the microorganisms at the full, and it can also cause the disease to others also. So, 1 to 5 days will be the peak period for the disease. The management will be, the dehydration can be dangerous, so give plenty of fluid, because as I said, major symptoms is the lot of thirst and severe diarrhea. So, dehydration will be there. You will have to take care for the dehydration, so give plenty of fluid. ORS, which is also known as oral rehydration solution, and give boiled, fresh and easily digestible food. Next disease we are talking about the typhoid. Again, the mode of spread is food and water. Symptoms are severe headache, fever with low pulse and dry coated tongue. And these are other symptoms you may have: the stomach pain, constipation, high fever, weakness, dry cough and the rashes on the body. How will you manage that? You need some kind of medical support here. The blood culture may need to be tested whether typhoid or not, and you need the medication also, but at home what you can do it, regularly wash the hands with the soap and water, drink boiled water, clean fruits and vegetable under the running water very clearly, and get vaccinated in time, and the incubation period for typhoid is 14 to 21 days. Next disease we are talking here, hepatitis, which is popularly known as jaundice, or in Hindi it is pilia. Again, mode of spread is food and water. These are some of the pictures difference you can see. This is a normal hand, little pinkish one. This is a jaundice patient head. Patient have the yellowish tinge in the head as well as in the eye. The symptoms are fever, dark yellow urine, yellowish tinge in the eye, general paleness, loss of appetite and abdominal discomfort. How to manage jaundice patient? You can see this patient fully yellow, he is resting. So, you need to give the carbohydrate rich diet and take as much as possible the rest, and incubation period for hepatitis 25 to 35 days. Now, we are talking about the influenza and popularly known as flu. The mode of spread is air. Symptoms are fever, aches and pains, chills. Chills means you feel like very shivering, and sudden symptoms get on the body, and tiredness, nausea. Now, we are talking about the tuberculosis. Mode of spread for tuberculosis is also air. Symptoms are persistent cough, and this cough may have in severe cases some amount of blood also, loss of weight and appetite, excessive weakness, rapid pulse, chest pain and special peculiar odor from the breath. Now, this is the mode of spread for pertussis. Again air. Symptoms are inflammation of the mucous membrane. We have the mucous membrane in the nose, in the throat, and that is get inflamed, and you have severe bouts of cough slowly and with a loud sound. Next is malaria. Malaria is due to the mosquito bite. Everybody knows by this time. This is a Anopheles mosquito which bites on the skin, and what happens? You have the fever, and this is a particular symptom of the malaria. This is a alternative fever, chill and perspiration, again fever, chill and perspiration. So, that is a typical symptom of the malaria: severe headache, body ache, nausea, vomiting, etc. Now we are much more worried about the dengue. And what is that? There are three conditions for dengue. Febrile phase, that means you have the severe fever, muscle and joint pain, headache, rashes on the mouth, nose, bleeding and vomiting and diarrhea. This is the first phase of dengue. In critical phase, you may have hypotension, that means fall in the platelet count and fall in the blood pressure. Pleural effusion is there, ascites, that means water retention in the abdominal area. There may be the gastrointestinal bleeding, and when this is recovery phase, after the treatment, there can be the altered consciousness, seizures, itching and slow pulse can still recover there. There are many other communicable diseases, skin to skin contact. During childhood, many must have faced the lice. They are tiny parasites, they live off on the blood in the scalp or the head. They crawl from head to head, which is why they plague the preschooler and kindergarten children, because they keep on talking and keep on doing the work. Scabies is another type of mites, burrows its egg on the skin and causes itching. Another is pinworm, which is orofecal, that means by some way the fecal material go inside and there can be ascaris. You must have heard that we popularly knows as the keede ho gaye, that is ascaris, and tapeworm is more severe. Now what we do it? Simple, because particularly in rainy season you are going to have more and more of the fresh water, but you are not taking care of that water. You are getting the vegetables and fruits, but you need to take the water. What you do it is maybe due to lemon bath. Fill the sink or bucket with the cold water, add 4 tablespoons of salt and the juice of 1 lemon, or soak for 10 minutes only and rinse with cold water. Or if you do not have the water, you can also use the apple cider vinegar. This is a simple method, but nowadays Clorox bath is another advanced version to clean our fruits and vegetables. Now, this is ORS, very popularly known as, and WHO, I take the name in the beginning itself, World Health Organization has prescribed to get rid of the dehydration, and particularly during the diarrhea, it is given to the children as well as to the adults in different proportions. Purchase the ORS. ORS packets are easily available on the chemist shop or health center. Put the content according to the dose you require in the clean container, that is very important. Add the water. Do not add ORS to the milk, soup and fruit juices. This has to be remembered. It should be added only to the water or the clean water, and do not add the sugar. And stir well, and in case of the infant, feed the solution from the clean cup or the help of a spoon, and do not use the bottle. If you are not able to get the ORS from the chemist shop, you can make it at home also. How? You just take 1 liter of clean drinking water, then 1 teaspoon of salt for this amount and 8 teaspoons of sugar. Mix well until sugar and salt is dissolved, and stir well, and then you can use it for as ORS. Now, the another dangerous communicable disease is HIV. HIV stands for human immunodeficiency virus. Now, be clear, the HIV is not the name of the disease, it is a name of the virus. This is one thing. Name of the disease is acquired immunodeficiency syndrome, that means that is called AIDS. AIDS is the name of the disease and HIV is the name of the virus. It is caused by the virus that attacks the body natural defense system or immunity. That means when immunity is very, very low, then only it can attack and further reduce the immunity to the negligible level. How it is spread? Please listen this carefully. One is sexual contact with the infected person, exchange of infected body fluids, blood transfusion, use of infected needles. The same needle has been put to the other person, from infected mother to the child during pregnancy or at birth. But AIDS cannot be spread by shaking hands, kissing on the cheeks, using the same toilet seat, standing close to the infected person through air or sneezing, coughing, through cups, glasses, plates and water or food. How to prevent from HIV virus attack? There is no cure for HIV or AIDS as yet totally, but there are certain protection or preventive measures you can use. Is restrict the number of sex partners to 1, use protection during contact, always use only properly sterilized needles for injection. Whenever you are getting injection, please check for that. Insist on getting properly tested blood from the registered blood banks when in need of a blood transfusion. From where you are getting the blood, that is very important, that blood should not be infected with the HIV virus, and seek medical advice as soon as possible if the child is infected with the HIV and from where it has come. Preventive measures. It is important to understand that HIV infection and AIDS are related terms but not the same. As I explained you, HIV is the virus and AIDS is the name of the disease. HIV infected person may not be suffering from the AIDS. An HIV infected person, if takes nutritious diet and maintains healthy lifestyle, can deter the onset of AIDS and can lead to a productive life for number of years. So, we should be very, very clear about the HIV, and HIV does not always mean that person is facing the problem of AIDS. Now, we are talking about the another kind of diseases, that is lifestyle diseases, and we have earlier understood what is lifestyle. This is the way we live. As the name suggests, if it is the outcome of defective lifestyle, how it comes? Faulty diet or eating more sugar, fat, oil, etc., regular smoking and lack of exercise. And these diseases include the diabetes, hypertension, popularly known as high blood pressure, obesity, heart disease or other lifestyle diseases. There are many. They are also called non-communicable diseases, and NCD letter is also popularly used. Lifestyle diseases are defined as those health problems that react to the changes in the lifestyle. All lifestyle risk factors have one common property. They make the breathing heavier and body oxygen low. This is difficult to check, but physiologically this is the action which are having in the lifestyle diseases. When you start breathing heavy, you must be very careful. And this is a technical word, cell hypoxia or oxidative stress. This is the same meaning. This is the driving force for the lifestyle disease. Now, how to care the sick person at home? We have understood different kinds of diseases, how they are spread, but we cannot, and it is not necessary also to send the patient to the hospital. We can have lot of care at home and person will recover faster. Consult the doctor immediately instead of waiting for the intensity of the disease to increase. Many a times this is a common problem. We are having the disease, we are having the symptom, but we keep on postponing or ignoring those symptoms until unless it increases in intensity. Now, follow the doctor's advice. Whatever medicines are prescribed should be given on time, and another thing, whatever is the duration for that medicines has been prescribed should complete the course. Many a time it does not look that if the symptoms are gone, the disease germs can still stay in the body and there can be the relapse of the disease. Give patient a proper and balanced diet as advised by the doctor, and see that the patient has enough rest. Keep the patient room clean, hygienic, and patient clothes should be changed every day, and preferably the bed sheet also, and give a sponge bath if possible. Now, what must do it in the balanced diet? As we keep on saying, in the balanced diet for the patient, large amount of the grains, more amount of the vegetables and fruits, and less amount of the moderate amount of the protein rich food, and the rare amount of the sweets. These are the vegetables, fruits. Why? Because they contain good amount of minerals, antioxidants and vitamins, and these are the things which are useful in protection of the disease and prevention of the disease. Now, what else you can do it? Chlorination of the water. Many times you see the water is little whitish in color. That is a chlorination, because this is very effective and for killing the bacteria for cholera, diarrhea, typhoid, and there are also viruses present. It prevents the polio and hepatitis, and to some extent it also prevents the protozoan and helminths. And what to do to live a healthy lifestyle? Simple things. You just live a very healthy lifestyle. What you can do it? Only 6 things. Eat right kind of food at right amount and right time. Next is physical activity. At least 40 to 60 minutes of daily exercise or vigorous physical activity is necessary, and that should be other than your regular work. That will help to be a healthy person and very productive person. Next is maintain the healthy body weight. This is also necessary. If you follow the other two, eating the right food and the physical activity, third can automatically be done. I'll pick up the last one first. Oral hygiene is very important. So, it is important to clean your mouth, because that is the entry point of your food and water. If your mouth is not clean, then it can cause the problem to rest of your body. And avoid or no to alcohol, smoking and drug abuse. These are some of the things you can follow to live a healthy lifestyle. Now I summarize the whole lesson, what you have learned about it. In this lesson, we are classifying the 2 diseases, communicable, which occurs due to the presence of or due to the attack of microorganisms, which may include the viruses, bacteria and other things. Another is lifestyle diseases or non-communicable diseases. That means these are not caused by the microorganism, but lower the immunity over a period of time, and this is the result of your faulty food habits, lack of exercise, alcohol, smoking and drug abuse, and sedentary life overall in one word. We have started this lesson, what is health and what are the symptoms and what are the factors which affects the health. If you learn that, then it is much more easy to just go opposite of that. If you do not follow that, it can turn into the disease. In the communicable diseases, we have talked about the incubation period, we have talked about the management, we have also talked about the symptoms and how to identify and how to manage things. We have talked about the cholera, pertussis, TB, influenza, jaundice, etc. Thank you very much.
जीवन ये प्रकाशित करने, राहों को आलोकित करने। हम अपना दीपक स्वयं बने, हम अपना रास्ता स्वयं चुने।
अपना दीपक स्वयं बने, हम अपना रास्ता स्वयं चुने।
जीवन ये प्रकाशित करने, राहों को आलोकित करने।
सीमा से विद्यालय जो मुक्त हो,
धन साधन समय की सीमा से विद्यालय जो मुक्त हो।
कभी पढ़े हम कहीं पढ़े, वे विषय की लोच से युक्त हो।
कभी पढ़े हम कहीं पढ़े, वे विषय की लोच से
और जागे,
मंजिल आने की ध्वनि सुने। हम अपना दीपक स्वयं बने, हम अपना रास्ता स्वयं चुने।
जीवन ये प्रकाशित करने, राहों को आलोकित करने। परीक्षा का अवसर एक बार ही क्यों मिलता फिर दुनिया में इसके केंद्र बात।
कोई मन चाहा केंद्र चुने, हम अपना दीपक स्वयं बने, हम अपना रास्ता स्वयं चुने। कोई मन चाहा केंद्र चुने,
हिंदुस्तान के हर कोने में नौजवानों के पास प्रतिभा है, उन्हें अवसर चाहिए।
NIOS देता रहा है युवाओं को अवसर आगे बढ़ने का। NIOS से पढ़ने वाले इन युवाओं ने किया है संस्थान को गौरवान्वित। दिव्यांगों ने बन के दिखाया है सबल और आत्मनिर्भर। NIOS के साथ आप भी जुड़िए NIOS के संग।